Thank you. So today's session will focus on the data that's available through the Massachusetts COVID-19 Community Impact Survey, and how that data can be made available for you folks to engage with and to use as part of your work. Can we go to the next slide, please? Today's session is hosted by Health Resources in Action, and I'm Abby Atkins, the Managing Director for Community Health Assessment at HRIA. We have with us today speakers from the Massachusetts Department of Public Health and our TA provider team from the Public Health Institute of Western Mass, the Metropolitan Area Planning Council, and the UMass Worcester Prevention Research Center. Next slide, please. Some housekeeping and logistics for today. If you could take a moment to introduce yourself in the chat box with your name and organization, then we can find out who's here with us today. To see just the speakers, please click speaker view in the upper right corner of your screen. There's a view option and you can change back and forth between the speaker and the gallery view. We will share all of the slides and the recordings following this meeting. And we fully recognize that guest appearance from household members or other work from home buddies could happen and are welcomed. If you have any questions throughout this process, please feel free to add those questions into the chat box. Later on in the presentation, we will have the opportunity for folks to ask questions of our speakers through an open question and answer period, and you won't need to use the chat box. Can we go to the next slide, please? Today, we're going to have an overview of the COVID-19 Community Impact Survey, or CCIS, an overview of the technical assistance process that's available for all community members to access, some data to action examples, and some new opportunities for folks to engage with the data. It's our hope that by the end of this session, folks will have an increased awareness of what the CCIS data is and other resources that are available. And they'll have the opportunity to build relationships with regional TA providers and increase an understanding of what the TA process is and what it can offer. We'll go to the next slide, please. To present an overview of the COVID Community Impact Survey, I would like to introduce Tai-Wei Lin from the Mass Department of Public Health.
Great, thanks so much, Abby. And it's great to be here. Great to see everybody in this room. I'm just going to provide a very high-level overview of the COVID Community Impact Survey to help ground us for today's conversation. I don't have a lot of time to go very much into detail, but my general goal is just to give you a sense of the approach that we took in this process, the types of data that we collected, and also the potential ways that the data can be used. And so on this slide is just some background on CCIS. So obviously the work was born out of a time of need. Like with other public health crises, we knew that the pandemic would have a disproportionate impact on populations and communities. We also knew that we needed real-time data to respond quickly to emerging needs, to help prioritize resources, and also to inform policy actions. And so DPH conducted a survey to help understand the specific needs of populations that have been disproportionately impacted by the pandemic, including its social and economic impacts. And the purpose of the data collection efforts would be to work with community partners to develop collaborative solutions and to help prioritize our pandemic response. Next slide, please. And so the survey itself was conducted in the fall of 2020. The survey was available in a number of different languages, and also some focus groups were conducted in ASL as well. And we also included a qualitative component to the data collection. And so there were some open-ended responses. And as I mentioned, some focus groups conducted. And in terms of how we recruited folks to take the survey, we really relied on our very large and strong network of community-based organizations and community partners to get the word out to different populations and groups that we know we needed to get information from. Next slide, please. And so on this slide are the primary domains of information that we collected within the survey. And so obviously, in addition to just some pretty in-depth demographic information and a number of questions related to perceptions and experiences of COVID-19, and within that, for example, access to testing and ability to social distance. In addition to those, we also collected a lot of information in other domains as well. So things like basic needs, access to healthcare, employment, mental health, substance use, safety. There were a number of questions related to all of these domains for us to better understand not just who was impacted, but also the intersections and understanding the root causes of why folks are being disproportionately impacted by the pandemic. And, as part of our sampling strategy, we intentionally reached out to priority populations that we knew that we needed information from. And so on this slide, you can see that we intentionally reached out to communities of color, LGBTQ plus individuals, persons with disabilities, essential workers, people experiencing housing instability, older adults, and geographically those living in areas hardest hit by COVID-19 as just some examples of communities and populations that we prioritized. And overall, the recruitment efforts were overwhelmingly successful. So we had over 33,000 adult respondents and over 3,000 youth respondents in our final sample across all throughout the Commonwealth. We had a lot of respondents from Western and Central Mass, more so than some of our statewide samples and some of our other surveillance systems, such as the behavioral risk factor surveillance system. And then compared to some of those surveillance systems as well, we were able to reach samples that we haven't been able to reach before, in numbers that we haven't been able to reach before. So for example, compared to BRFIS, or the behavioral risk factor surveillance system, we had 10 times as many respondents from Alaska Native and Native American residents, 10 times as many from LGBTQ plus respondents, 5 times as many residents who speak languages other than English, and many more populations as well that by and large we have a hard time or are unable to collect enough information to report out on. CCIS was able to gather information from these populations that largely are invisible in some of our other surveillance systems. Next slide, please. And so, in terms of what we were hoping this information could help inform, on this slide are just some of our initial ideas. When the CCIS was created, we were hoping to collect information that can not only inform how we make testing access and awareness more equitable, how can we inform a more equitable approach to vaccine deployment, thinking about resuming delayed care during the height of the pandemic, and then also thinking about how we support other things as well. How do we communicate our findings? How do we offer better mental health supports to populations of need? How do we think about risk mitigation? And so, the survey itself was designed to collect a wide array of information that was flexible enough to be able to inform not just the items that you see here, but many of the other items as well that hopefully our community partners are interested in. So I know that was a super fast and high level overview of CCIS. Hopefully gave you a general sense of what the purpose of the survey was and a little bit about what's in there. I would recommend for folks, if you're interested in learning more, please visit our website. So you can see the link here. On that website, you can not only find out more information on the survey itself, there's also a question and answer document that compiles some commonly asked questions that we've received. And then also we have a number of things like introduction webinars to give you a better sense of sort of how we conducted it and why. There's a lot of findings that we have on our website as well. So we have a full report that's available. We have a number of data tables, different spotlights on different populations and topics, a lot of different webinars, and we also have a data dashboard if you were looking to explore some of the data yourself. And, as I mentioned, we have some of these topic specific reports on our website as well. So the slide decks are available for all of the topics that you see on this slide, ranging from access to healthcare, to social determinants of health, to specific populations like young parents and sexual orientation and gender identity. And in addition to the slide decks, we also pair those with recorded webinars as well, to help walk through some of the findings and key takeaways from each of those topics.
So I can take over here. Hi, everybody. My name is Stephanie Lemon. I'm the director of the Prevention Research Center at the University of Massachusetts Medical School in Worcester. And I represent one of the three organizations that fills the roles as a technical assistance provider for CCIS. And so I'd like to take just a minute to talk to you about this technical assistance model and how it works. So DPH, in its infinite wisdom, saw the utility and potential for the data from CCIS to support a wide range of community partners in their work, and sought opportunities to make this widely available for community partners to be able to access the data, utilize the data for their own purposes, whatever it may be. And so hence they set up this technical assistance model. The purpose of technical assistance is to help municipalities, community-based organizations, and other community partners to access, analyze, interpret, and contextualize the critical health equity data that the COVID-19 community impact survey can inform. This includes everything related to pandemic response, recovery planning, and just general, sort of long-term effects that the pandemic has had in exacerbating many of the social and health inequities that our communities experience. Available supports from the technical assistance providers, and I'll just briefly restate that there are three, one in Central Massachusetts, which is my group, the UMass Worcester Prevention Research Center. In Western Massachusetts, you'll hear from the Public Health Institute of Western Mass, and in Eastern Mass, you'll hear from the Metropolitan Area Planning Council. And what we do as technical assistance provider is help you sort of access and utilize this data. So there are many existing findings from the CCIS that can help be explored and see if they're utilized to meet your needs. We can fulfill customized data requests using CCIS data where appropriate. This can include things like regional and local estimates, population-specific health equity analyses, as Taiwan mentioned. CCIS did a really nice job of purposely sampling populations that are otherwise not usually represented in these types of surveys, and then other analyses that are not already released on the CCIS website. We can help sort of contextualize and interpret the CCIS data at the local and regional levels, support community partners as they use the data to make recommendations and take action, and provide information and answer questions about the data, including its methodology, the sample of the respondents, and data limitations. So in terms of how to access the technical assistance providers as a resource, there are several steps that are laid out here on this slide. The way that we've set it up is that usually we ask, we do some outreach, but really it's up to community partner to inquire and to learn about what the opportunities are. Then we set up an initial discussion with the relevant TA provider to talk about what your interests are and whether or not the CCIS can help you accomplish those interests. The TA provider then is responsible for conducting preliminary analyses. So we all have access to this data and are very facile in using it. And then we meet again to discuss the findings and go over them with you. As needed, we'll perform additional analyses for you, and then we hope to meet again to sort of finalize the findings and sort of help the community partners go off to use the data in a way that is most beneficial to them. And now we're going to spend a little bit of time going over some examples that the TA provider have already worked on to give you a flavor of the types of things that we can work on. And I believe we're starting in Western Mass. We'll turn it over to Kathleen.
Great, thank you. So I'm Kathleen Zegna. I'm the Director of Community Research and Evaluation at the Public Health Institute of Western Massachusetts. We provide support for folks in Western Mass, the TA provider, and have responded to requests in a number of different areas. This is an example of one. I am going to turn it over to my teammate, Victoria Ramos, who's going to share about this particular data request regarding or focusing on LGBTQ plus youth in Springfield. So Victoria, I believe you're sharing the slides for this right now.
Be helpful. Yes, Emily, it's okay. Hi everyone, I am Victoria Ramos. I am working with Kathleen on the CCIS TA technical assistance. So for this example, we work specifically with Springfield Pride, which is a new organization that is currently organizing the first ever Pride Parade in Springfield's downtown. It was super exciting to meet with them. They were very much in the throes of planning for their parade and really wanted to be intentional about thinking about LGBTQ plus youth in Springfield. What are they experiencing? What are their needs? How can this parade really be an opportunity to reach youth and in a way that makes sense? So to start that, they were really interested in understanding what were the current data that were available in our region that could speak to that. So the CCIS data was very helpful for them to get a glimpse at what were the needs of LGBTQ youth during COVID, what were the impacts, what would be the most pressing things for action that they could move forward in their organizing efforts. So in order to create our data request, we met with the founder. We were able to really think through what was available in the survey, what could the survey tell us, how can we interpret the findings from the survey, and we kind of worked closely to think through what were the most relevant pieces from the CCIS data that we should include for this. So out of that, we decided to think about the impacts on youth mental health. We know that LGBTQ youth face a huge disparity when it comes to outcomes on mental health. And we know that from our Springfield Youth Health Survey, which we also administer. So we tried to think about what other data sources are available in our area that can help us interpret what to focus on, what to find. And we can do that with anyone who submits a data request. We try to think through what makes the most sense to include in our analyses. We also looked at youth substance use behaviors and a few other additional data points. So from that, our findings were that LGBTQ youth in Springfield had a high burden of poor mental health outcomes. So we saw that about over 60% of LGBTQ youth in Springfield were experiencing 2 or more weeks of poor mental health in a row in the last year. We saw that there was 3 times as much substance use behaviors in LGBTQ youth compared to cisgender heterosexual respondents. And we also saw that there was a lot of needs and worry about meeting their basic needs when it came to internet access or access to food. And there was quite a few folks that were requesting resources on how they could address these things. So we prioritize sharing those findings in terms of what could help with action, especially when they're thinking about this parade as an opportunity for outreach and meeting the needs of LGBTQ youth in Springfield. So those are some of the action steps that we see that came of this, is that, and I'll share this on this next slide, that these were the 3 biggest outcomes that came from the findings in our CCIS analysis. So 1, engaging youth. How can we use this data to just elevate what's happening, or what did the youth respondents to the survey share? What were their experiences? How can we lift those experiences up and share with the Springfield at large? How can they inform their planning efforts? So they were thinking about this parade beyond just an event that's going to happen this summer. They were thinking about how can we create mentorship spaces? How can we create resource networks for LGBTQ youth in Springfield? And this data was really going to help advocate for those resources and engage other stakeholders that are interested in this data. And the last piece is just identifying areas for future inquiry. So we know that the CCIS data really tells us about what respondents that were engaged had to say about what they're facing, but we know that there's other voices that we may have missed, and they may be having similar experiences. So thinking about what other questions we can be asking to provide some context to what we're seeing in the survey would be a great outcome of this. Any final thoughts, Kathleen? I wanted to share.
Yeah, and so just go ahead.
No,
Well, and so just in terms of what information is useful to people in a variety of different ways, whether it be in a table format, chart, we've done slide decks, data bites, which I don't know if people know what that means, but kind of easier infographic form or summaries. So if you want to just go to the next slide, Victoria. So just an example, this was something that was done that is more data by infographic, just as a way of engaging, really help, putting this information out there so that people might be interested in learning more to understand. And then next one, just an example of how similar to how DPH has analyzed how we might share some of the information overall. So that's an example of how the survey was used in among LGBTQs, trying to understand how respondents in Springfield the information could be used to inform efforts.
Before we move on to the next group, and thank you, Kathleen and Victoria, do we have any questions for Kathleen and Victoria about the work that they've done or some of the deliverables that they've provided? Kathleen, roughly how long does it take from when somebody comes to you and asks and starts a conversation with you about the data that they need to get to the point where you have some deliverables for them that you've defined together?
So that's a great question, and it really depends. At some points, we've had like 4 or 5 requests that we have in our queue to work on, so it's a little longer. I know in this one, it was a very short turnaround time, which really drove what we were able to do. I think it turned around in a week. Right now, with some that are coming in and working through, it's probably somewhere between a couple weeks and a month. But just depending, again, it really just depends on what folks are looking for. There's a different one that we're working on with the Women's Fund of Western Mass, and that one, it's going to be more drilling down in different areas, and then also they're interested in some form of infographic. So that's just going to take a little longer.
Great, thank you.
Sure.
So our next example comes from the Metropolitan Area Planning Council, and I am going to hand it over to Barry.
Thanks, Abby. And thanks, Kathleen, for that example. And thank you, Emily, for helping get our slide up there too as well. I'm from the Metropolitan Area Planning Council, which is a regional planning agency serving Greater Boston. But in this case, too, we have the privilege of acting as the TA provider for Eastern Massachusetts, so that for folks on the call, that goes all the way up to kind of the Merrimack to the north, to the south coast, as well as covering the Cape and the islands too, just for awareness. So the example that we're sharing today relates to substance use. And again, I want to give great credit to my colleague, Sharon Ron, who's on the line as well too. And Sharon, feel free to jump in as I do this particular piece. And it focused on substance use and a coalition that is coming together around a substance use prevention grant. They're beginning a new grant cycle. They're in a moment where they are kind of thinking about, they had a good understanding of their residents, their communities, substance use issues that they were seeing people facing, both kind of rising and falling. But really with the pandemic dropping in there, they feel like there's this great interruption of their understanding. They know there's anecdotes they can find, they know there's input they can find from folks they work with, but they were looking for some kind of greater measure to help be a bridge between what was before the pandemic, what happened during the pandemic, and essentially kind of where they are as they begin to kind of pick up their work again in a collective fashion too. So we had a great conversation with them as they showed interest in the CCIS data and really wanted to, again, dig into those areas of both adult and youth substance use and what that looked like and how it may have changed through the pandemic too. Again, looking at the CCIS data, what they found is kind of this power of now, and I think Tawe highlighted this earlier, was a more to kind of understand certain populations that experience as opposed to just kind of a general municipal or community level experience of substance use. And so we're now able to kind of go in with the CCIS data and dig a little bit deeper to look in how that plays with essentially if you're a person of color, LGBTQ+, in those areas as well too. So thinking about those interactions with substance use and how it may show up in different populations. At this point, we've produced frequency tables that are going to show what that spread of experience looks like and the characteristics that they were looking for in those crosstabs, and really get a sense of what those trends have looked like. So we feel like we're beginning to provide a kind of a brick, like I said, a bridge between those two sides of the cliff of what they understand. we don't really necessarily have outcomes yet because we're really in the discussion phase with the group to see how it's going to work for them. But in early conversations with them too, there are a number of areas that they thought this information was going to be really important. One, as they come out of their assessment phase, those particular strategies that they want to pick up, again, that either works as a coalition across the 7 cities and towns, or that might actually just work locally as a coalition member. Looking to, again, within particular municipalities, they both understand they're at different places and how their leadership, how their community organizations take action around this. So thinking about this as a way to have local strategy work around prevention. And lastly, I think as they begin to ask other questions and look at some of these other opportunities coming down, such as like the infrastructure funding, other kind of COVID-related relief efforts that are happening, how can they inform some of these other efforts in addition to their own prevention strategies too? So for us, it's been a really great example to understand kind of the why this data is important, because it answers questions that they would not be able to answer normally, but also the importance of it within the moment of creating that bridge between what they did know and where they are now in their process for all that particular piece. I'm going to stop there and just check with my colleague Sharon just to see if she wants to add anything to that.
No, Barry, I think you did a great job summarizing. I think that the only thing I may add was that similar to what you've heard interwoven with other people talking about this data, is this group had done qualitative data collection through interviews or focus groups or informal conversations with people throughout the pandemic. And so sort of knew that there was a story, but having this data really allowed them to look at a collective experience and connect these bits of stories that they had heard into a larger narrative. And looking forward to seeing how having that larger framework of data enables them to move towards action.
Thanks for making sure to lift that up. Thank you, Sharon. Turn it back to you, Abby, and to Emily.
Do we have any questions for Sharon or Barry on the work that the Metropolitan Area Planning Council has done? Well, my question for you was to be about how were you adding in qualitative data collection, but Sharon answered that piece. So I'm going to throw a different question at you, Barry. This topic and this conversation may be relevant to folks who are not in your Eastern Mass catchment area. Can you talk a little bit about how the TA providers talk to each other and work together?
Sure. So again, we have this great opportunity once a month to kind of come together as TA providers to share our experiences. And that's an opportunity where we both kind of get to cross-pollinate ideas. So looking essentially what UMass is doing, what the Public Health Institute of Western Mass is doing, and looking at those particular elements and sharing that. But it's also a place for us to share challenges, because I think with any data set, it's imperfect. And so really having those conversations around like, how do we kind of flesh in or kind of deal with aspects that we can't get at directly? Again, to the question you're going to ask earlier, Abby, is how do we kind of bring in some of these qualitative elements that really kind of fill in the gaps between essentially the information points we might have from the survey itself too. So that's a big part of it. And again, we also try to keep track with one another of the requests that are coming in a bit of a live fashion, so we can see what one another are doing within the work, so that we're either not overlapping, but really can kind of take advantage of the assets that we're all kind of creating through this process.
Great. Thank you, Barry. So our final example is from the UMass Worcester Prevention Research Center, and I'm going to hand it back to Stephanie, who you met earlier.
Hi, everybody. And I'm actually going to hand it off to Chris Frizard, who's the biostatistician who's been working with me on all of this to go through the presentation today. So take it away, Chris.
Hi, everybody. Our example is an analysis we did working with the New England Institute for Native American Studies at UMass Boston. We wanted to create a real spotlight on that population, and we knew that they were really the experts that could give us the context, give us the background in the Native American population. So we came up with some general sort of analyses that looked at healthcare and behavioral health and things like that, and we sent it over to them. They met as a board, and then came up with some more focused questions and some more a deeper dive into the analyses that they wanted us to do. So we took a look at healthcare services and access, behavioral health, and basic needs. We looked at all of those and looked to see if there were differences by age or gender, urban or rural place of residency. And we also looked to see if there were differences between Native American, those who identified as Native American only, or Native American with another racial ethnic identity. We looked at some frequency distributions, and we presented those data weighted so that we could see if it represented, so our results could represent the Native American population in Massachusetts. So they had some interesting findings. We went back and forth with them a couple different times. We created a nice slide deck. They also participated in some focus groups so that they could provide more context to the data. But we found that more than half of them reported healthcare and medical needs since the pandemic began, and 30% reported a delay in care. About 43% reported 3 or more PTSD symptoms, and almost half of those reported that food or groceries were among the top household needs. And they are going to take these data to their advisory board and use it to inform their priorities, outreach, and advocacy. Anything else to add, Steph?
Thank you, Christine.
Thank you.
That was really helpful. Are there any questions for Christine and Stephanie about this example? Christine and Stephanie, I think when folks are thinking about making a TA request, that sometimes people get a little bit nervous. What do I need to know? What do I need to have prepared? To what extent does a detailed request need to be made? Or to what extent does that need to be made? What do people need to have prepared for you when they are coming to start their inquiry around the CCIS data?
I think it can be highly varied. I think it can be a very general idea. There doesn't need to be a fully formed idea. We understand that people don't necessarily know the intricacies of this data and what it's capable of, and also what it's not capable of. And so sometimes even before a formal conversation, a formal request, just an informal conversation can make things a lot more efficient. So don't be shy about reaching out if you have just sort of a general idea that you're interested in and would like to explore that isn't fully formed yet. Inevitably, even if it is a fully formed idea, we're going to have to go back and forth about what the data sort of can and can't do. So please don't be intimidated. This TA model is here for a reason, and we're looking for folks to collaborate and work with us.
Thank you, Stephanie. Given some of the examples folks have seen today, are there any topics or areas that that you might be interested in and in exploring more within the CCIS data? If something comes up, please feel free to add it into the chat box. Stephanie, Barry, and Kathleen, can you tell us a little bit about recent requests that you've received? Why don't we start with you, Kathleen?
Sure. One that comes to mind, we were just talking about this today, is a rural health request. And so similar, what we're finding is that people are, well, actually in this case, I directed them to the analysis that was done at the state level, and they were interested in having a similar analysis that might be able to use both to inform their CHIP work, their county health improvement plan, but also advocacy. And so they are now wanting it focused on their particular county, and similar type of analysis as was done at the statewide level to understand inequities in rural areas within their county. So that's one example that they'll take to their planning, their CHIP planning meeting coming up later at the end of this month or beginning of next month. Another one is youth mental health. And so that's been a very large focus and work going on in our area, and particularly for the community health needs assessments that are underway. So this data will be used as part of the efforts to focus what the assessment will look like for the youth mental health work for their region. And in addition, in combination with the other youth mental health data that is existing out there, the youth surveys, some of the other qualitative work. So just to say that similar to what others were saying, we try to encourage people to really think about how this data fits with other data that is being gathered to better understand whatever they're trying to focus on. So those are a couple examples that have just come up very recently.
Great, thank you, Kathleen. Barry, any new examples on out of MAPC?
Yeah, again, coming in more recent as well too. One, the Mass Association of Community Development Corporations has a health equity subcommittee, and they've reached out recently, kind of again seeing the importance of the data. So they've invited us to one of their subcommittee meetings to talk more about the CCIS data examples like we're sharing today too. And this is something I think to your earlier question, making sure to connect back with the other TA providers because the CDCs are across the entire state. So we'll have that conversation upcoming. And then actually just today, we some folks from the Cape and Islands just, I think, learned again, caught that essentially kind of the meaning of the data and the importance. And it sounds like on essentially the outer Cape, there's an interest in essentially doing a needs assessment. So they've just reached out recently and we're hoping to meet with them shortly to again, kick off that process of the initial conversation, see how we can be helpful. But it does feel like it's fitting a bit more into that kind of needs assessment space that people are looking at right now.
Great, thanks, Barry. Stephanie?
Yeah, our requests have been very similar, several related to community health assessments and CHIP processes. We've also gotten a few requests from, a mayor's task force that are looking for data to sort of supplement their ongoing activities in areas like food security and food access. And then we've also gotten requests really to help groups that have been working, that were working on ARPA related kind of prioritization, again, to echo what Kathleen was saying, to really bring this data in as sort of a piece of the puzzle to help, make a case for some of the strategic priorities that different community groups and collaborations are interested in.
Thank you, Stephanie. So that brings an end to the examples that we had so that folks had a sense of how the data was being accessed and how the analyses were being used. Taiwei, I turn it over to you. Do you have any updates as to when we may see a survey again?
Yeah, thanks, Abby. So I'm excited to sort of share with you all that, we are in the relatively early stages of a planning process for the next iteration of the COVID Community Impact Survey, what we're calling right now CCIS 2.0. And so, we are trying to clarify what our goals and objectives are for that. Obviously we're in a different phase of the COVID-19 pandemic right now, but we're still, we still understand that the information that we've collected in the previous iteration of the survey continues to have information that I think is both relevant and useful for folks. And so thinking about the next survey, we want to take a long-term approach and think about an opportunity for us to build a sustainable data collection system that folks can continue to use to help inform their policies and practices and to ultimately address health inequities that we're seeing both within populations and then also, within specific geographies as well. And so what that means for you all is that, as part of the planning process, we are going to be organizing a lot of opportunities for different folks to help inform what the next survey is going to look like. And so stay tuned for that. If you are interested in being a part of that process or interested in just staying up to date with the next iteration of the survey, please reach out to us. There's an email linked here, COVID-19 survey at mass.gov. That email comes directly to our CCIS team, and we'll make sure that you're put on a list that, and we'll reach out to you directly. And yeah, so stay tuned for that. And then we'll also continue to, engage in conversations and create opportunities for y'all to use our data from our current iteration. In terms of the timeline, we're still not exactly sure when we're going to roll out the survey. I think there are some decisions that we need to get made, and also just thinking about when makes the most sense to collect information to help support our needs. And so unfortunately don't have a very general timeline to give, but again, please feel free to contact us and we'll make sure you're kept up to date.
Great, thank you, Taiwei. And a formal thank you to the Western Mass Prevention Institute, to the the Metropolitan Planning Council, and to the UMass Worcester Prevention Research Center, and DPH for joining us today for this discussion. We will be sending out the slide deck so folks can review the slide deck and have access to the contact information for each of the TA providers. Good luck with all of your work in the future, and thank you.